To health matters now. It's projected that cancer death rates in Africa will rise exponentially over the next 20 years, overtaking the global average by an added 30%. This is why the Multidisciplinary Cancer Committee of the Federal Medical Center in Abuja has organized a meeting on sharing perspectives to help close the cancer care gap in Nigeria through a multidisciplinary approach. This formed the crux of discussions to commemorate the World Cancer Day with the theme, Close the Care Gap, in the nation's capital. Kemi Balogun has more on the story.
Africa records about 1 million new cases and 700,000 cancer deaths every year. Nigeria accounts for more than 100,000 of these cases annually. Breast cancer, cervical, prostate, liver and colorectal cancers account for almost half of the new recorded cases on the continent.
Yes, it is a killer disease. It is a very serious one, but it is not a death sentence.
They say prevention is better than cure, but we don't do that preventive measure, so we now discover it late, and then that's why the scourge is so high amongst us.
Finding of cancer disease is a very expensive disease that whoever is involved took a lot of extraneous measures to find a way of overcoming it.
Close the Care Gap is the theme for this year's World Cancer Day, and it marks the start of a 3-year campaign to raise awareness around cancer and its impact, especially on the most vulnerable. A shortage of specialists in the medical and radiation oncology field, pathology, medical physics and other essential areas also add to this gap. Speakers here want this to change through a multidisciplinary approach to patient care.
We all know that cancer is not managed by one person. It is a multi-modality and multidisciplinary approach to it. So we have a committee that ensures that and roll out policies to ensure that the free journey of patients once they are diagnosed and they first present in this hospital until when they complete their treatment.
One major issue that came up in the conversation is the issue of financing for cancer. And we think that there is two things that really needs to be solved. It's the health insurance system needs to be fixed, and two things needs to happen. People need to know that the contribution they make is in their interest, but at the same time they need to be protected such that when they are sick, that money really comes back to help them solve their problems.
See where we need to close in the gap, ranging from manpower, equipment, psychotherapy, advocacy, research, because we have a poor culture to research in this country.
People don't even know that there is a fund from Ministry of Health for about 2 million for indigent cancer patients. We are trying to talk to the government. Like, there's no reason why every zone in Nigeria should not have a PET CT scan. A PET CT scan does not cost more than #1 billion.
The MCC is keen on seeing that the multidisciplinary approach is improved to ensure that cancer patients who remain at the center of care of all cancer journeys have equitable access to all that is required for them to beat this deadly disease. Kemi Balogun, TVC News, Abuja.